Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric OKelly. This week, we are talking with Burjor Langdana, who created a niche focusing on expedition dentistry. Burjor, welcome to the program.
Thank you, Aebhric. Thanks for having me on the program, and it's great to be chatting on your podcast.
So tell us about yourself and what keeps you busy.
Okay, about myself. Basically, I am at the end a product of numerous consultants, medics, trainers like yourself who put in a lot of time and effort into teaching me and sharing their skills with me. So I did my MaxFax Masters in India, in Bombay, which is now Mumbai. And I did my head and neck oncology there also. So what that taught me was like how to work with the basics, because in India in those days, we could not afford bone plates. So we had to use jaw wiring, and we became very, very, very good at wiring. And also just due to the shortage of hospitals there at that time, we treated an enormous number of patients. And I keep telling my students, at the end of the day, there is no shortcut to experience in numbers. You have to treat certain number of patients consistently to build a strong foundation from where you can then extend yourself. So also we did a lot of dental camps there into various remote areas, and that taught me the basics and generated an interest of how to do dentistry and treat basic facial injuries in a remote austere settings, and develop my own skill set for that subject. So from them I went to Oman. I worked in Ministry of Health and Defense, and it was brilliant because it was nice working in a supremely well-equipped clinic. From there I did my fellowships in head and neck, in maxillofacial surgery in UK. And those were the days when we used to work beyond the legal hours, which came down from the EU. And it was fantastic because you worked consistently under pressure, and hence you further enhanced your skills. I still remember the day when I did nearly 18 jaw fracture plating over a long weekend, and my consultant found me grinning from ear to ear. But what he told me was really important. In that one sentence, he said, yeah, this could be your 18th, but it's the first one for the patient. So don't ever forget that. And that statement has stuck to me ever since. So from there, I went to New Zealand, and where I did my mobile surgical services training. And that was again because of my training. I had to do it under supervision of a remote supervision of a consultant. And he really improved my plastic surgery training and how to improve my suturing skills. I also did a VSO, which is voluntary service overseas in Malawi. And so all this time I worked in a physical presence or close to a physical contact, if needed, of a consultant. And for the first time, I had to go to a place where there was no consultant cover as such. And that's where I realized it was so important to network and get to know your colleagues around you, so that if any help is needed, the others who've been there for years are really good to tell you and share their skills with you. And I remember there was a Filipino consultant there, a true old-style general surgeon. And what he said was at the end of the day, surgery is like physics. So essentially, for example, we didn't have postnasal pads. So if there was a mid-face fracture, we couldn't access Foley's catheters. They were expensive. Epistats, I don't even think were there at that period of time. And we just thought at the end of the day, if you want a balloon tamponade, you need a balloon, irrespective of what that balloon is. So we used a Cox catheter, which is an ops and gynae catheter, simply because when you inflate it, it was a balloon at the end of a tube. So if you push it in through the nose and you inflate it, you get a balloon at the end of the tube. And you need a balloon to put pressure in that area. And that is a really good skill to think of and realize. It's even when I teach extraction to the combat medics, I tell them at the end of the day is physics. So it's essentially a wedge and a lever principle. So if you think of it as physics, it's much easier to deal with these emergencies. So then I came back to UK, became a general dental practitioner with a surgical skills specialty. But then I got a chance to go to British Antarctic Survey for 3 to 4 seasons and work on the ship. And that is another skill to learn, is like, how do you work on a mobile ship with somebody who's not dentally or max fax trained? And we realized that we had to get better at it. So every time it was rough seas, we used to do simple dental procedures and hence develop a protocol on what if we had to do an emergency procedure in a rough sea, what would make the procedure more simpler? And we realized one of the main factors was our suction machine kept wandering around the place on rough seas. So it was just a simple bungee cord, tying it down. The lamp kept wandering around. Again, just simply holding it in place. So we developed set protocols for that. And then now my day job is essentially as an NHS dentist. But what NHS dentistry shows or trains you or gives you is stamina, because we treat a lot of patients one after the other, one after the other. So you develop the skill to rapidly see a patient, check the patient, establish a treatment plan, and treat the patient, and repeat that process one after the other, one after the other. So therefore, when we go on deployment with Team 5 Medical Foundation for humanitarian dentistry, and it's an American Special Force Vets charity, that skill is really useful because you're seeing one patient after the other. You have to quickly diagnose, format a treatment plan, treat the patient, supervise the others, teach the skills, share the skills with the others, and keep a watch on how many patients are waiting outside. So it gives you the multi skills which you need. Also, dentistry in general teaches you acting skills. Essentially, when you meet a patient, you have to reflect calmness, confidence, and control. Inside, you might be panicking to your wits' end. But if you keep treating nervous patient day in and out as a part of your profession, you can get that skill down to a T. So that is what I do also as a part of my dental work and facial trauma work in UK. And of course, I also teach. I think teaching is the best way that we can learn and pick up new skills. So the difficult bit is to teaching the different people. For example, we teach expedition medics, we teach combat medics, and we teach search and rescue medics. And each requires concentration on different skills. And that is where I find it a bit hard, because like you, I want to teach everything I know to everyone. And that is hard. So you have to get that balance right. And you consistently, like yourself, I'm consistently fine-tuning my workshops, etc. For example, initially for expedition medics, I used to teach everyone how to extract teeth. And initially they wanted to learn it. Then they said they wanted to concentrate on other aspects, so we stopped teaching that. Then the refugee camps came across, a huge refugee crisis came across, and we started teaching that again. And now again, they just want to learn and concentrate on how to do local anesthesia, how to treat a front tooth that's knocked out, how to do a temporary filling, and just practice those common things. The individuals who want to learn how to extract teeth, or the medics who want to learn how to extract teeth, are very few. So therefore, we've adapted ourselves and we teach now extraction only to the combat medics. Similarly, for search and rescue medics, we used to teach them how to do mid-phase splinting, how to combat mid-phase bleeding. But again, a search and rescue medic only has to look after the patient for around 6 hours approximately before handing it over. So they wanted more time to practice on bandaging, lateral patient transfer, how to control hypothermia, how to maintain the patient in a lateral position for facial injury and transport them. So we instead decided it was time well spent on concentrating on that and kept that skill for the combat medics, because combat medics for their prolonged field care essentially need to learn wiring, jaw wiring, need to know mid-face splinting. So we kept that aspect for them. But then we don't spend as much time teaching them bandaging because they learned it through their other trainers. So it's that adaptation and a constant balance of process where you want to teach the or utilize the time the best way they want it utilized. So yeah, that is what I'm doing just now and very happy doing it. Thanks to you guys.
Your name keeps popping up, and we've met ages ago. I think it was in Edinburgh that you and I first met, and you're the spearhead for expedition medicine, and you teach the SCAS lads in Hereford. You teach the NATO and SOCM course in Fullendorf, Germany, and you are pushing this training for special forces medics. Bertha, where did you get this passion? I mean, how did you come about to focus on such a niche subject as pre-hospital expedition dentistry?
The passion of teaching comes from my mom and dad, actually. They love teaching. So essentially, they like infused that teaching into us. And the other thing is that the consultants who worked with me, looked after me, I mean, they were like genetically tuned to teaching. They were so passionate about sharing their skills, so passionate that we learned their skills. That's what drove me to this. And then when I came here, of course, it was hard breaking into teaching on a bigger scale. So Mark Hannaford, through World Extreme Medicine, he first introduced me through Amy Hughes. She was the medical director in those days. So that's where I started the pathway of teaching here in UK. And then by teaching the subject through the other organizations, generally it's spread. But I mean, at the start, when I was taught to teach DIM, the remit was that it has to be hands-on and it has to be doable because they are going to have a rapid water rescue before they come to your class. It's a round robin. If you have theory, they'll go to sleep. So therefore, right at the start, we try to figure out how to make it hands-on. And if you make it hands-on and do it repeatedly, then you imbibe the knowledge into the person you want to teach. It's exactly like how you do your teaching. Your teaching is all hands-on. And that is what, remember, you didn't even show a single slide in Walter. It was all hands-on. And hands-on teaching is the way to go.
I think that there are two types of knowledge. One is your head knowledge, which you can get from a book or from online. And the other knowledge is the hand knowledge. And in my experience on the streets is the head knowledge will go away. You'll be half asleep at 3 a.m. and the rain's coming down sideways and your head is just gone. But it's the hand knowledge that's doing your CABC or doing your assessment because you've done it so many times. It's just the knowledge is in your hand. And sometimes my head will finally catch up to my hands somewhere around the breathing or the circulation of the assessment because it just takes a while for the head to catch up sometimes. So I believe you need both. Yeah.
Absolutely. I love that statement, but the head catches up with the hands. That is so, so true. And it's fantastic. And like, yeah, it's fantastic. That's such a lovely statement. Absolutely agree wholeheartedly with that. And also the other thing is repeatedly teaching. Like now we are like the next, I'm going to do a Langdale and Ambleside search and rescue teaching. And the essence was they did it like a few months back and now I'm going to go back at it. So it's essential to constantly refresh and constantly train. Otherwise, if you don't do it that often, you tend to forget. And repetitive motivation and reinforcement is important. Why? Because you're repeating the same thing as well as you're adding new things which you discovered in the last year. So because we just discovered, we started using IT CLAM module, which is the new module which we've added. And that is also something which they give you good teaching aids. So you may not necessarily have the gadget to use, but you can use it to teach. Like for extract stretchers, you can use it. Of course, it's great if you have it, but if you don't have it, it's a fantastic teaching aid to drill the thoughts of how important it is not to get the patient cold, how important it is to stabilize the patient, how important it is to control the wetness of the patient. So all these things are teaching aids plus gadgets to learn. So it's a mixture of both. Yeah.
So, Burjor, you just recently popped down to Malta to speak on the Quorum conference. How was that experience for you?
Fantastic. It was really, really good. I think we only got like 5 teaching kits and we had to do the workshop for 20 plus students, but they were so good, so focused, so experienced. And the faculty around, it was also good enough and fantastic enough because I was writing notes and learning things from what the other faculty were teaching. I picked up so many tips myself in the conference, besides sharing the skills which I learned. And it was an excellent resource to share knowledge back and forth, back and forth. It was really, really great. I mean, I'm looking forward to the next one now.
Yeah, we're already taking bookings for the one in February coming up, and we'll have to get you down again to do the same thing.
Oh, fabulous. Look forward to that.
So, Burjor, you mentioned that there is a specific number of dental patients does it take to be comfortable with the skills. So, what would you suggest for the remote medic, the special forces medic, or the nurse to what does it need for her to get to the point where you're comfortable with them doing some of the dental skills?
I think at least 10 injections was what I think to get absolutely comfortable to work by yourself. But so what we do is, see, we know that if somebody comes, they'll probably give like on an average they would probably do 10, 20 injections and then go away, come back to the next deployment or not, and you would easily forget what you just learned. So what we do is before anyone comes on deployment, we send them an MP4 video whereby we go through all the skills, i.e. how to give local anesthesia, how and what are the instruments for dental extraction, how do you identify them, how do you use them, and how do you do intraoral suturing. So we send them an MP4 video to them. And then when they come, the first day they are there, all of them give me a proper injection, including pushing the local anesthesia in. So half my face is numb on that day. The idea is that you actually have to push the needle in and push the liquid in to get confidence. And if then also morally and ethically I can justify that if I am confident of them giving an injection in my mouth, then I should be confident morally and ethically for them to give the injection on the patients which you're treating the next day. The next thing is that they go through physically all the extraction stuff, what is there, and we go through that. But what we were losing was that we were not going through the suturing. We used to always give the MP4 video and presume that they would be just because suturing the skin, suturing the mouth, same. And we realized actually it was not. So they were having a hard time suturing in the mouth. So what we do is the night before they are coming to clinic, we practice suturing in the dark with a head torch on anything which we have, possibly a banana, any cut stuff. So they get the hanger working in a dark, moist environment, i.e. the mouth. And we also repeat the hand tying skills. Now, you very rarely, if ever, have to hand tie the mouth. But because they learn how to use their fingers. It's nice skill to know how to slide the knot down inside the mouth, and it just gives them more tactile skills. So it's very important to refresh simply because very few people will consistently do a dental or a facial trauma procedure consistently throughout the year. The other thing is because we do on multiple short deployments, like 3 or 4 times a year, we have picked up a lot of tips to make it easier, like positional tips, how to work when there's no water, how to prevent patients from getting medical complications because they walk for miles to reach us, then they have a dental extraction and they go away. So nowadays, we always give them a glucose tablet before we start. And that is what we share with other armed force dentists. Like recently, I had one with the Australian military dentists, or the forces dentists, not military dentists. And it was great to share this. And the same thing with recently with the Colombian force dentists. So it's great to share these skills because we are in a lovely situation where we get to learn things doing multiple short-term deployments.
That's pretty interesting. You definitely have been putting together a lot of fantastic information, and you're giving people the chance to turn that head knowledge into hand knowledge. And one of the things that really interested me right off the bat ages ago was the fact that you created the Expedition Dentistry website. Can you tell our listeners about what content you have there and how it'll help them learn?
Oh, sure. Yeah, yeah. So we have this Wilderness Expedition Dentistry website. Now, that website is totally free. So we have a lot of printed articles there, which you can read for free. We have tons of MP4 videos there, which shows you how to give local anesthesia, how to do a temporary filling, how to reduce a jaw, how to do jaw wiring. All that is there. And also we got, because we know where we all go, you cannot get internet access freely. So there is a PDF of a dental handbook, Expedition Dental Handbook, which you can download and essentially carry with you, or downloaded or a printed version. And I got tired of everyone asking me what kit should they take. Now, basically, it all depends upon your skills and the length of your deployment. So therefore, we have a site where we classified it according to different types of kit, which we would advise you to take from short, intermediate to long-term deployments. And it is a suggested kit. Don't forget, you should have the skills to use that kit. Otherwise, it's pointless taking that kit. And that is what is also included totally free on the website. And it's basically a teaching resource. It's a good place to direct people to who ask questions.
I'm curious, how many hits do you get every month on that site?
Oh, I haven't checked. Don't know. Yeah, I got to update it a bit more because recently we've been sharing a lot of contents on the YouTube, all the different teaching videos. Like we made a recently an osteodentistry teaching video, and essentially all the webinars which we have, like even the armed forces webinars, we tend to make it into an MP4 video so that the others can see it and share in that knowledge. Basically, we want to get more dentists involved into this, so they through the website they have access to the PowerPoints which we use in a PDF format. They can make their own PowerPoints from that, and we want them, other junior dentists or senior dentists or experienced dentists, to start teaching other medics so that we transmit these knowledge to medics worldwide, so they share the dental knowledge. I've had a toothache. I don't want anyone else to suffer with a toothache. I had a toothache while doing one of the 3 peaks in Yorkshire, and I had to literally run down the peak, ring up a friend who met me in the clinic who did my root canal. Now, I don't want anyone else to go through that. Possibly you won't have access to such lovely friends. And I want them to try to control this dental emergencies in places where there is no qualified dentist available.
So what would the basic dental kit you would suggest for someone who's not going to be able to do any of your hands-on training, but they'll have a quick look at your website and download your PDF for offline use? What would the first thing would you suggest for them to bolster their medical kit?
Or definitely something like a pre-mixed temporary filling material, something like Cavit or Coltine. It's pre-mixed. It's got zinc oxide in it, so it's soothing, very, very easy to use. It sets by contact with saliva, gets firm, and stays generally. So that is one thing for sure. The other thing is so lots of medics carry that, but what they don't carry is something which is a filling material, which is adhesive and sticks like super glue to the teeth. And that is known as glass ionomer filling material. Now, if you're on a mountain biking trip or a road cycling trip, and if you fall off and chip your front tooth or some tooth, And if you want to put an intraoral bandage, that is your intraoral bandage because it can stick to any chipped tooth like super glue, cover it, protect it from sensitivity, and basically protect it from infection to going in. So it's another good thing to carry. The other thing which is nice to carry would be the nasal clip of a face mask because that is a very good dental splint. So if somebody knocks their front tooth out or gets loose, you can put it across the front of the tooth and stick it to the adjacent teeth and that naughty tooth with the glass ionomer filling material, which chemically sticks to the teeth. So those are the things which I would encourage people to carry. If at all something to clean the teeth with, a small excavator, and cotton rolls will be anywhere there in your pack. And if you don't have an excavator to clean, just think of the physics. If there's a hole in the tooth, what do you have to do? Clean it, cover it, and protect it. You can use anything which you have to clean the tooth. You can use a broken matchstick to clean the tooth. You can use a floss to clean the tooth. Anything, just think of the physics behind it. And then you got to cover the tooth up. If you cover the tooth up, if you have cavit, it's supremely easy just to plug it into the hole. If you don't have cavit, then you have to think of what you can use to cover the tooth. Of course, everyone's read about it. You can use chewing gum to cover the tooth. You can use wax to cover the tooth. But those don't seal the teeth well. So every day you got to like lift it out, clean it a bit, leave some toothpaste in, and then cover it again well. So just think of the physics, and that's easier than to treat the patient.
I'm definitely a big fan of cavit. It's lightweight and it's super small, and it's something you definitely need in your medical kit. And I'm fond of the idea that you have of improvisation. So you mentioned having the metal bit on the nasal oxygen mask as an option for dental work, and I get, the thing is, Burjor, is you get it. You understand austere medicine, and you have created dental options, but using either improvisation or thinking outside the box on how to fix this, and it's really impressive.
Oh, thanks a lot. Yeah, yeah. I basically learned a lot from you. I mean, you improvise big time. You have like two podcasts dealing with improvisation in medicine. And that is what we should always have in our toolbox. You see, you have to think of the physics and then you have to think of improvising. It's so important.
And you and I have discussed the idea of a postgraduate certificate in expedition dentistry or austere dentistry. What would you like to see taught during that program?
It would be great if it's a part of expedition medicine PFC with dentistry and facial trauma mixed in it because it's a part of a rounded thing then. I mean, it would be great to have a day of dentistry and a day of facial trauma. And that would extend from primary management of facial trauma, somewhere like for an expedition medic or a search and rescue medic, all the way to a combat medic. So we do that for the whole day. And similarly, dentistry, the dental part, which should be a day, and a facial trauma part, which should be a day. But the dentistry would be essentially to get confident and practice enough on how to give local anesthesia, how to give a good deep temporary dental filling, what to do for teeth injuries. What if someone knocks his front tooth out, chips his front tooth, which is so common, especially in marine medical field. The chipped front teeth seems to be the very, very common sort of a problem. And also how to do intraoral suturing and get the hang of intraoral suturing. And finally, how to do a simple dental extraction. I mean, you may never do a dental extraction, but then somebody with you, like a doctor or an advanced medic with you, might have to do it. And that is what we, as you know, are doing in the special forces training nowadays, is that the doctors and medics are training together so that if somebody gets tunnel vision, the other member of the team can contribute, widening the tunnel back up, giving some lateral thoughts. And two heads are better than one. Team is definitely the way to go to solve any issues which one can come across, because that happens so often that you can stop thinking when you're faced with an emergency, and then you need the feedback from the people around you, and that makes you a more rounded member of the team. So that is what would be good to have.
I'm a big fan of team mentality. I've been working on the ground on a critical casualty as a paramedic and being supported by EMTs and first aiders. And I have at some time stopped and like, all right, lads, as a team, what do we have here? What are we missing? What are we and more often than not, somebody with 1 week of training, a first responder, or a remote EMT with 4 weeks of training, they'll be like, well, what about this? Or I mean, everyone has a brain. Everyone has the ability to be part of the team. And I never want to be the one that says, well, I'm the critical care paramedic. There's nothing that I can get from advice as far as a team. It's really important to have that team mentality.
So true. So true. I mean, the recent workshop which we did with the K Rescue, I mean, with those, I think of very few medics. The others were all critical care providers, but highly experienced critical care providers. And the questions they put forth is the best questions I've ever come across in any teaching workshop. I had to literally go back to the faculty, to the companies to re-ask those questions. And they were beautiful questions. It was fantastic. So essentially, like, everyone can feed in and just open the bandwidth that exists. Team is the way to go for sure.
And being able to teach this to the level that you're addressing. And I love the challenge of trying to come up with ways to teach complex medical concepts into a way that a knuckle dragger can get that. And it's such an amazing experience to be like, remote EMTs are brilliant to teach. They're just starting out. They have no training at all. And then when you teach the whole concept of alveolar respiration, or the difference between that and metabolic respiration, and then you get the light in their eyes when they're like, I get this. I understand now why we're doing this. It's such a rush.
Fantastic. Absolutely. So true. 100% true. Aebhric, you hit the nail on the head. Absolutely.
So, Burjor, the last question that I always ask our guests: what advice would you have for the remote paramedic, the new nurse, the new doc, who is just starting out on their career in austere medicine?
Whoa. Yep. I would say get fit. Be physically fit. I mean, it's such a hard job. You have to be strong enough to look after yourself and strong enough to look after others. Be good in the basic skills of just looking after yourself. And then you will have enough bandwidth, enough leftover stamina to look after others. And because at the end of the day, you got to act your calmness, confidence, and control out. And if you're exhausted, irritable, or worn out, you will not be able to do that. So consistently, and just there's no shortcut to experience, and you will never have experience for everything. So every nugget of experience you can get is just built on and built on and built on. You're just building up your toolkit, and there you always have to just learn as much as you can. There's nothing that you can say, I'll never do it, because you never know when you will need it. And it should be at the back of the head that if you can. And networking. Keep networking as much as possible. And that's where the people who I know have to suffer with my numerous questions that pop across in the middle of the night to them.
Burjor, it's brilliant to get you on as a guest. And you and I have had a history of many, many years. And I definitely appreciate you being in my network and being and holding that knowledge of dentistry for austere environments. And you are definitely leading the herd, leading the world on that concept. I really appreciate that.
Thanks, Aebhric. Thanks so much for having me. And thanks for being so many years around and answering all the questions which I put forth to you, and sharing all the knowledge and experience that you have with me and numerous other people. Thank you so much.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.